This video is for NURS 5130 Pediatric Assessment Lab, Module 3 assignment. Today's date is August 8, 2021. This is my student ID. First, I will quickly scan the room. That is my supplies. First, I will wash my hands. I'm a nurse practitioner student. Today, I will do the head-to-toe assessment for you. Do you consent to be videoed for this assignment?
Yes.
Do you mind I don't wear face mask?
No, I don't mind.
Okay. Could you please tell me your name and date of birth, please?
My name is Mike Wu. My date of birth is July 1st, 2001.
Could you tell me today's date, please?
Today's date is August 8th, 2021.
Could you tell me where you are?
We're in a hospital building.
Could you describe your mood?
Pretty good.
Okay. The patient is alert and oriented with people, place, and time. He is a 20-year-old male. He can follow my commands. He is able to communicate. He appears properly. Okay, Mr. Wu, I will start the head-to-toe assessment. First, I will assess your skin. I will inspect your skin first. I have a look at your skin here.
Mm-hmm.
The back side. Okay. Then your leg. You can relax. The skin is intact. There is no rash. It's brown color, no nodules. Next, I will feel the skin temperature, okay?
Mm-hmm.
Okay, the skin is warm and nice. Then I will assess the skin turgor and edema. Okay, the skin turgor is back quickly. There is no edema. Next, I will assess your nail. Could you show me your fingernail for me? Okay, your nail is normal in color, shape, and thickness, and the refill is less than 2 seconds. Let me have a look at your toenail. Less than 2 seconds. Less than 2 seconds. Could you do this angle for your hand nail for me, like this?
This one?
Yeah, I will have you do for every finger.
This one?
Yes.
This one?
Yes. 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 Okay, you can relax now. The angle is 160. There is no sign of clumping. Next, I will assess your hair. Your hair color is black and straight. I will feel it. Okay.
Mm-hmm.
I will feel your hair and the scalp. Your hair and scalp. The hair is smooth and nice. Any tenderness?
No.
Okay. There is no nodule, no message, no tenderness, and there is no belt spots. Then I will assess your head. Your head size looks appropriately. Your face is symmetrical. Eye and ear on the same level. There is no abnormal face movement. Okay. Next, I will assess your temporal mandibular joints. Could you open and close your mouth for me? Okay, close your mouth. Okay, I'm feeling the clicking sensation, and there was none. Non-clicking sensation. Then I will assess the cranial nerve 7, facial nerve. It's a sensory nerve and motor nerve. Now, could you please close your eye tightly for me? Open your eye, please. Smile for me. Frown. Puff out your cheeks. Okay. You can relax now. Could you taste salt and sweetie?
Yeah.
Okay. That means your cranial nerve 7, facial nerve is intact, both motor function and sensory function. And then I will assess the cranial nerve 5, trigeminal nerve. It's a sensory and motor nerve. Now could you clench your teeth like a bite down? Okay. I will feel the masseter muscle is firm like a ball, and the temporal muscle is also firm. Could you open your mouth against the system? Okay, you can relax now. That means your cranial nerve 5 with the motor function is intact. Then I will do the soft, dull, and sharp experiment. Okay. And this is soft, this is dull, and this is sharp.
Okay.
Now close your eye for me, please. Tell me what you feel.
Soft. Dull. Sharp. Sharp. Soft. Soft.
Okay, you can open your eyes now. That means the cranial nerve 5 with the sensory function is intact. Next, I will assess your sinus. I will feel this is the frontal sinus. Any tenderness?
No.
Could you take off your glasses for me, please? Thank you. And this is the maxillary sinus. Any tenderness?
No.
Okay. And then I will do the Translatory Test. I will use a light to shine above your maxillary sinus, and then observe it through your mouth. Okay. Okay. Now please look up for me, please, and open your mouth. Okay. I see the light through the upper plate. Then the other side. Yes, the same. You can close your mouth. I see lights through your both sides. That means the maxillary sinus is clear. There is no occlusion. Then I will assess your eyes. Your eyes looks equal and in the same level in your face. The eyelid is no swelling. The sclera is white and shiny. Iris is brown. The pupil is about 3 millimeter. Then I will pull down your conjunctiva. You can look up forward. Look up for me, okay? Okay, it's pink and moisture. No red, no drainage, no aeration. Now close your eye for me. And tenderness. Okay. Now I will assess the cranial nerve 3, ocular motor nerve, cranial nerve 4, trochlear nerve, cranial nerve 6, abducens nerve. These 3 nerves are motor nerves. They control the eye movement. Now I will use this pen light. Keep your head still. Do not move your head, and then your eyes follow my pen light. Okay? Okay. There is no involuntary movement. Next, could you look at the object in the wall and stay there for me? And I will shine the light from the side of your eye, okay? keep your head still. Do not move your head. Okay, the other side. Okay, the pupil contract from 3 milliliter to 1 milliliter. Next, we will do the accommodation test. I will keep this pen light here and then move it close to your nose. Your eye follow the pen light, okay? We will start. Okay, the pupil contract. Then we will do the cover and the uncover test. Now stare at my nose and use this to cover one of your eye. Now cover the other of your eye. Okay, that's it. There is no eye movement. This test told us the cranial nerve 3, oculomotor nerve, cranial nerve 4, trochlear nerve, cranial nerve 6, abducens nerve are intact. Next, we will assess the cranial nerve 2, optic nerve. This nerve is a sensory nerve which involves the vision. Today we will not do that, but I will explain the test for you. Okay? We will use an eye chart, which is called the Snellen chart. We'll put the chart on the wall. Then you stand 20 feet away from the chart and cover one eye. Use the other eye to read the smallest line of the chart. That test tests the distance version. Then you change the other eye. Next, I will handhold the eye chart and in 14 inches from your nose. The same thing, you cover one eye, then use the other eye to read the smallest line on the eye chart. Then we will test another eye. This test tests the near vision. So these two tests, the distance vision and the near vision, test the cranial nerve 2, optic nerve. Today we will not do that. I will just explain that to you. Next, we will do the ophthalmoscopic exam. I will use this equipment to observe the inside of your eye. Okay. First, I will test the red reflex. Now, just stare. Let me open it. Just steer this scopic. Okay, red reflex noted. Then I will move close to your face, and I will very close to your face. Okay. We'll brace your head, and okay. Then I will observe the other eye. Restart. Moving. Okay. I use my right eye to observe your right eye, my left eye to observe your left eye. There is no optic nerve damage, no blood vessel abnormal, no renal detachment. There is no renal infection. It's normal. This is the end of the eye exam. Next, we will assess your nose. First, I will inspect your nose. Your nose is symmetrical. There is no lesion, no redness on your nose. I will feel it. Okay? Any tenderness?
No.
There is no tenderness, no modules, no masses. Could you occlude one side of your nose, then breathe with the other side? Any difficulty?
No.
Okay, then do the opposite side. Any difficulty breathing?
No.
Okay, your nasal or your nose is patent. Then I will look inside of your nasal. Okay, I will use the otoscope, and there is a light to observe the inside of your nasal. I will breathe you can relax. For both sides, the nasal is pink and moist. There is no foreign body, no aeration, no drainage. The septum of two sides are intact. Next, I will assess the mouth. First, the outside of the mouth. The lip is pink and moist. There is no drainage, no crackling, no cyanosis. Then we will assess the inside of the mouth. I will wear my gloves first. My pen light and the tongue blade. Could you open your mouth for me? The gum is pink and moist. The tongue is dull red color. There are about 32 white teeth. There is no teeth caries. Could you raise your tongue for me? I will all those underneath. Okay, it's pink and intact. Then I will feel a little bit, okay? Any tenderness?
No.
Okay. The upper and the lower plate is intact. Then could you raise your tongue up and down for me? Then side to side. Okay, you can relax. That means the cranial nerve 12, hypoglossal nerve, is the motor nerve is intact. That controls the tongue movement. Next, could you please say ah? Let me use my pen light. Say ah. Okay. I will poke the back of your throat, okay? The gag reflex noted. That means the cranial nerve 9, glossopharyngeal nerve with the motor function is intact. Could you taste the bitter and sour?
Yeah.
That means the cranial nerve 9, the sensory nerve, is intact. Just now, when I observed the back of your throat, I see it's pink. There is no swelling. The uvula and when you say ah, the uvula and the upper plate move in and forward. Your tonsillar size is 1+ or 4+, which is normal. There is no swellingness. Could you swallow?
No.
Are you able to swallow?
Yeah.
Yeah, that means your cranial nerve 10, vagus nerve is intact. You can talk with me without harness, and you are able to swallow. Cranial nerve 10 is a motor nerve. This is the end of the mouth assessment. Next, we will assess your ear. Your ear are equal in the same level on your head. There is no obvious abnormal. I will feel a little bit, okay? Any tenderness?
No.
Okay. There is no module, no message, and no tenderness. Then I will look inside of your ear by using my otoscopy. I will pull the pinna up and back. Okay, I will look at the other side. Pull up and back your pinna. For both sides of the ear canal is clear. There is no theremin, no occlusion, no drainage, no aeration. I did see the tympanic membrane. The membrane is gray color. There is no fermentation, no bulging, no rupture. The corneal light in the left side is in 7 o'clock, right side in 5 o'clock. Next, I will do the Whipper test. This test assess the cranial nerve 8 vestibular cochlear nerve. I will stand back from you. Could you occlude one side of your ear? I will whisper 2 words and then you repeat it for me, okay?
Okay. 1, 2.
Could you occlude the other side of your ear?
5, 6.
Okay, this means the cranial nerve 8 vascular cochlear nerve is intact. This is a sensory nerve involved hearing. Next, I will do the Weber and Rene test. This is a tuner shock. I will put it on the middle of your head. You tell me whether you hear the sound equal in both sides or one side is louder, the other side is weaker, okay?
Mm-hmm. It's equal.
Okay. Next, we will do the Rene test. You tell me when you could not hear the sound, okay?
Mm-hmm. I couldn't hear it. Oh, it's good. Couldn't hear it yet.
Okay, the other side.
Cannot hear it. Cannot hear it.
Okay, for the Weber test, the patient could hear the sound equally in both ear. And for the Rene test, the air conduction is longer than the bone conduction, which means the hearing is normal for the patient. This is the end of the ear test. Next, we will assess the neck. Your neck looks symmetrical. There is no lesion, no obvious abnormal. I will give you the water. Drink the water and swallow for me when I tell you, okay? Wait. The trachea is in the center of the neck. Okay, now you can drink and swallow for me. Okay, the thyroid and the thyroid cartilage is aligned in the middle of the neck. You can put on your glasses now. Thank you. Then I will feel propel the carotid artery. It's in the goal of the neck. Then the other side. Okay, it's a nice bonding. It's a 2+. I will use the bell of my stethoscope to listen to the carotid artery. Hold the breath for me, please. Okay, you can breathe normally. Okay, hold the breath, please. There is no swishing sound, no blue rays. Then I will assess the cranial nerve 11, accessory nerve. Could you move your head up and down, side to side? Now shrug your shoulder against my assistant. That means the cranial nerve 11, accessory nerve, is a motor nerve, is intact. Then I will assess the lymph nodes. I will start from the back, the back of the head, the occipital lymph nodes. Post-auricular, pre-auricular, any tenderness?
No.
Then at the end of the jawline is the tonsillar. Any tenderness?
No.
Submandibular, submental, any tenderness?
No.
Then the anterior cervical chin line, posterior cervical chin line, any tenderness?
No.
Could you please shrug your shoulder for me? Just a little bit. This is the supraclavicular lymph nodes. Any tenderness?
No.
Okay, you can relax. The lymph nodes is non-palpable, no hardness. The lymph nodes I could not feel the lymph nodes. It's normal. Next, I will assess your chest, lung, and heart. Could you take off your shirt for me, please? Okay, your chest is symmetrical. There is no signs of difficulty breathing. There's no heels or lifts. I see there's a tunnel chest. When did you first notice your tunnel chest? Here.
About 13 or 14.
Does it affect your daily life?
No.
Any difficulty breathing?
No.
Okay. Then I will feel your chest, okay? Any tenderness?
No.
Any tenderness?
No.
Okay. I will palpate the pericardium. It's the fixed intercostal space, the mid-cervical line. It's a nice bonding 2+. Then I will count for 1 minute for the heart rate. Okay, it's about 72 per minute. I will observe your anterior and posterior chest and the transverse chest. It's 1 to 2. I just make sure you don't have the barrel chest. Next, I will percuss your chest. I will put my hand on your chest in different locations and then percuss it and listen to different sounds, okay? While I do this, you can just normal breathe through your mouth. The mid-cervical line. Mid-axillary line. Okay, could you turn around so that we can see your back? Okay, thank you. No more breathe through your mouth, okay? Okay, the resonance sound was heard anteriorly, posteriorly, and laterally through the whole lung field. Okay, you can turn around and sit down for me. Thank you. Next, I will listen the lung sounds. I will use the diaphragm or my stethoscope. You can deep breath through your mouth for me, okay? The trachea area. The second intercostal space. The fourth intercostal space. The sixth intercostal space. Sixth intercostal space, mid-cervical line. The sixth intercostal space, axillary line. In the trachea area, I hear the bronchial sounds. The expiratory sound is greater than inspiratory sound. In the second intercostal space, I hear the bronchial vesicular sound. The expiratory sound equal to inspiratory sound. In the fourth and sixth intercostal space, I hear the vesicular sound. The inspiratory sound is greater than the expiratory sound. Could you turn around for me so that we can see your back? Here is the C7. This is the bone prominence. You could not miss it. And between the shoulder blade is the T3. C7 and the T3, between C7 and T3 is the upper lung lobe, and below T3 is the lower lung lobe. I will use the diaphragm on my stethoscope. Deep breath for me. Thank you. Okay, in the upper lung lobe, I can hear the bronchial vesicular sounds. In the lower lung lobe, I can hear the vesicular lung sounds. The inspiratory rate is 18 per minute. The breath is normal. There is no labor, no waves, no recall. Next, I will test the tactile parameters. I will put my hand firmly on your back. Follow me to see 99, okay? 99.
99.
99.
99.
99.
99.
Okay, I will put your turn around. 99.
99.
99.
99.
Okay, there is no tactile parameters. Next, I will assess your heart. I have already inspected your chest. There is no heaves, no lifts. I also palpate the pericardium for the apical pulse. The heart rate is about 72 per minute. Then I will listen your heart sound. I will first use the diaphragm my stethoscope, then I will use the bell. Now it's the diaphragm. The second intercostal space, right sternal side, is the aortic valve. S2 larger than S1. Pulmonic valve, S2 larger than S1. The third intercostal space is the earth point, S2 equal S1. The fourth intercostal space, tricuspid valve, S2 smaller than S1. The fifth intercostal space, mid-cervical line, is the mitral valve, S2 smaller than S1. Then I will use the bell or my stethoscope for the same location to listen the heart murmurs. The second intercostal space, aortic valve, pulmonic valve, earth point, tricuspid valve, mitral valve. Okay, the heart rate is 72 per minute. The rate is normal. There is no murmurs, no gallop, no raps. Next, I will assess your artery pulse. Could you please lie down for me? First is the temporal artery. It's here. Then it's brachial pulse. Brachial pulse. Popliteal pulse. Posterior tibial pulse, dorsal PDS pulse. We could not see here. This is post-tibial and dorsal PDS pulse. The pulse is 2+, which is normal. Next, we will assess the abdomen. First, I will inspect the abdomen. It's flat, round. There is no hurry, no rupture. Then I will listen the abdomen by using the diaphragm of my stethoscope. I will start from the lower right quadrant and then clockwise. The abdomen sound is normal. It's about 6 per minute. It's active. Then I will listen the artery. I will use the bell on my stethoscope. Aorta artery, renal artery for 2 sides, iliac artery for 2 sides. If necessary, we'll also listen the femoral artery. The artery is normal. Next, I will percuss the abdomen. I will start from the lower right quadrant. Tympanic sound was heard. Then I will percuss the liver area. I will start from the lung field, then downwards to find the downest sounds. And after that, I will start from the right upper quadrant of the abdomen and upwards to find the downest. I will start. I will mark on your abdomen, okay? I will measure the lung spine. Okay, it's 8 centimeter. Then I will percuss the spleen area. The spleen located in the 9th and 11th intercostal space, the mid-axillary line. I will start from the 9th intercostal space. Okay, this is the spleen percussion. Next, I will do the light palpation and the deep palpation. Any tenderness?
No.
Any tenderness?
No.
Okay, I will do the deep palpation, okay? Any tenderness?
No.
Any tenderness?
No.
Okay. Then I will palpate the McBurney points. I will press slowly and then release quickly. You tell me whether there is any pain.
Okay.
Any pain? Okay. Next, I will assess the Murphy sign. I will press here. Deep breath for me, please. Any pain?
No.
Okay. The McBurney points and the Murphy sign is negative. Next, we will assess the drawer test. I will bend your knee to 90 degrees, and I will sit on your feet. Okay, the other leg. Okay, the drawer test is negative. Next, could you please sit down, stand? Could you please stand up? I will percuss the CVE and back to the camera. Any pain?
No.
Any pain?
No.
Okay. Now could you please walk around before the camera?
Walk around.
Yeah. Okay, you can stop now. And the gait and posture is normal. Now could you please face the camera and back face to me? A little bit here. And then lean down to touch your nose, your toes. Touch your toes. The spine is straight. There is no sign of scoliosis. Okay, you can stand up slowly. Next, we will assess the range of motion. Could you turn around to face to me? Okay, just follow me. First, we will assess the neck. Bend down, bend up, turn side. I'm sorry. The other side, ear to the shoulder, ear to the shoulder. Okay, now relax. I will do that for you, okay? Okay. The active and passive range of motion of neck are both intact. Next, we will do the shoulder. Just follow me, okay? Forward, backward, external rotation, internal rotation, okay, adduction, abduction, okay. Now relax, I will do that for you, okay. I will do one by one arm, forward, backward, external rotation, internal rotation, adduction, abduction, the other side, forward, backward, adduction, abduction, external rotation, internal rotation. Okay. The shoulder active and passive range of motion are intact. Next, we will do the waist and bend forward, bend backward, bend side, the other side. Okay, swing your upper trunk in a circle. Okay, now relax. I will do that for you, okay? Bend forward, backward, bend side, the other side. Okay, swing, swing. Okay, the active and passive range of motion of waist are intact. Next, we will assess the ankle. You can sit down here. Thank you. Okay, just follow me, okay? Bend downwards, two sides. You can do two sides together. Upwards, bend side, the other side, turn, turn. Okay, you can relax. I will do that for you, okay? Downward, turn side, turn, turn, up, down, side, turn, turn. Okay, the angle, active and passive range of motion are intact. Next, we will assess the epidental reflex, okay? Okay. Relax. This is the biceps. Okay. Triceps. Okay. The brachial radius reflex. Okay. And the other side of the arm. Biceps. And the triceps. Relax, okay? Okay. The brachial radius reflex. Okay. Then the patellar reflex is here. I think we need like this and let your leg Okay, the other side. Okay. Next is the Achilles reflex. Okay, then the other side, the Achilles reflex. Okay. The deep dentin reflex are 2+, which is normal. Then we will do the Babinski reflex. Okay, Babinski test is negative. Next, we will do the coordination test. Just follow me, okay? Put your arm open and use your finger to point to your nose. At the beginning, do it slowly. When I see faster and faster, then you do it faster and faster, okay? Okay, let us start. Do it slowly. Then faster and faster. Okay, you can stop now. Okay. Next, we will put your hands on your thumb. Then you turn it over and left the thumb. Yes. First, do it slowly, then faster and faster, okay? Faster, faster. Okay, you can stop. The coordination test is intact. Next, we will do the vibration test. I will put the tuner fork on your bone prominence. You just tell me when you feel the vibration, okay? Do you feel it?
Yes. 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 Yes.
Okay, your vibration sensation is intact. Then we will do the soft, dull, and sharp experiment. You remember this is the soft, this is the dull, this is the sharp.
Yep.
Now close your eye for me, please.
Soft. Dull. Sharp. Dull. Soft. Sharp. Soft. Dull. Sharp. Soft. Dull.
Okay. Your soft, dull, and sharp sensation is intact. We have already do the drawer test, the Murphy-San, Weber test, Renee test. We also test the tactile remedies. We did the transilluminated test. Now we need to do the Romberg test. Could you stand up for me, please? Okay. Turn around and close your eye. Okay, you can keep the balance. You can open your eye now. That means that you passed the Romberg test. I think this includes our video. Thank you for your participation. That's the end of the video. Thank you. Thank you.